SIPS has two names, stomach intestinal pylorus preserving surgery, and in the United States they call it SADS, single anastomosis duodenal ileostomy with sleeve gastrectomy, but they're exactly the same operation. And SEPS is a modified version of duodenal switch, which has been used for weight loss surgery for about 20 years. The first stage is doing a sleeve gastrectomy, so we form the stomach into a small sleeve that decreases the amount you can eat and takes away the hunger hormone called ghrelin. We then divide the small bowel at the very top, a part called the duodenum, about 2 centimeters distal to where the stomach ends, which is called the pylorus. And we bring up the lower part of the small bowel and connect it to the top part of the small bowel, so that we bypass a required length of small bowel. The length of that bypass can be varied depending on the patient's needs and in particular on the patient's desired weight loss. But typically the bypass with SIPS will be longer than the bypass with a mini gastric bypass. So there is more malabsorption with SIPS than there will be with mini gastric bypass, so there's less absorption of the fats, of the sugars, the carbohydrates and the calories, and patients tend to lose most weight with SIPS than any other procedure. The big advantages of SIPS is definitely the weight loss. A patient with SIPS will lose more weight than if they had a sleeve, a bypass or any other type of weight loss procedure. The other advantage with it is because of the way the joint's done together, there's less chance of something called an internal hernia, which can happen with the Roux-en-Y gastric bypass. Also, because the joint is not onto the stomach but is actually onto the small bowel, the duodenum, there is less chance of the patient getting an ulcer at the joint, which can happen with other types of bypasses. The disadvantage is there's two staple lines, so there's the joint and the staple line from the sleeve. Staple lines can have complications such as bleeds or leaks, although those complications are now rare due to the improvements in the staple technology, the use of collagen and fibrin glue to strengthen the staple line. But there is more staple lines with SIPS than there is with a mini gastric bypass, so there can be more complications from SIPS. Secondly, with SIPS, we do have to keep an eye on your nutrition. So because of the greater amount of malabsorption, you have to take supplements every day, and occasionally you'll need a vitamin B12 or an iron injection to help keep your levels up. The ideal candidate for SIPS is patients who are super obese, so a very high body mass index greater than 50, and also diabetics. SIPS has a wonderful effect on diabetes, and the vast majority of people who undergo SIPS, their diabetes is resolved. Other ideal candidates for SIPS were patients that are hungry, patients that are overeat, but in particular it works best in patients who have a high calorie food addiction, patients that like the foods that are so calorie dense. SIPS would involve having an appointment with me and the dietitian, and we would then design a preoperative plan for the patients. Typically this would involve getting blood tests, a scan, sometimes a gastroscopy, and it would involve seeing the dietitian to mark out an eating plan. So 2 weeks beforehand we would have them on a light diet, and then the week before SIPS we would have them on a very low calorie diet, where they would probably have Optifast sometimes twice a day with one little meal, but often if they've got a high BMI we require them to have 3 Optifasts a day and no meals the week beforehand. With SIPS, because of the high BMI, we aim to have a weight loss of about 7 to 10 kilograms before we do the procedure, in an attempt to make the procedure safer and easier. Post-surgery patients will be in hospital 2, sometimes 3 days. For the first 2 weeks after surgery, it will be liquids only, water, tea, coffee, juice, soup. Weeks 3 and 4, we then get them onto pureed food, thick in soups, thick in yogurt, scrambled eggs. And on week 5, the SIPS patients will start on solids. They'll be able to eat all types of food, but only about half a cupful at a time.